All right, so I think we can start. So welcome everyone. This is such an amazing time to welcome all of you. So now I will let Charles Toomey, so the co-founder of Action for Diabetes, to just give a tiny little introduction before moving forward. Charles.
Okay, great. Thank you very much, Anne-Charlotte, and good morning, everybody. Very nice to speak to you. I'm calling in from Thailand. I live in Thailand, and in fact, I used to live in Malaysia for about 3 years, in the 2020 to 2000 to 2003. So very happy to be talking to you all in Malaysia today. So from an Action for Diabetes perspective, we're extremely proud of the support that we've had, and with both ISPAD on an international basis and also the MOH of Malaysia and other various organizations in Malaysia as we've gone about developing our approach to launching the Hello Type 1 platform in Malaysia. I'd specifically like to call out the thanks and support we have from the Faculty of Medicine at the University of Malaya, and particularly Prof. Azriyanti for their support and her team, and the support of the translation of the materials by Professor Yazid and his team also in helping us organize and plan and be ready for this launch for Hello Type 1. In addition, we've had tremendous encouragement and enthusiastic help from the MEMS group, the MDES, FMSA, and also the Baxter team in Malaysia for their tremendous support and help with the video adoption. We're particularly grateful for Dato Dr. Asmayani, also from the Ministry of Health, for agreeing to give the opening speech and endorsement of Hello Type 1, because it's very important for us to get endorsement from the key players in every country to really ensure we have a good utilization and launch of the program. I'd like to give maybe a little bit of just a very brief background on Action for Diabetes. Actually, although we're a UK registered charity, all our activities are based here in Southeast Asia. We have operations in Myanmar, Laos, Cambodia, Thailand, Malaysia, and Vietnam. And the reason we started this organization about 7 years ago was because we realized, particularly in Myanmar, Laos, and Cambodia, that there's a huge problem in terms of lack of diagnosis of type 1 diabetes and no free access to medical supplies, insulins, blood testing, etc. in those countries. Plus the doctors themselves, who one would normally expect to have experience of managing type 1 diabetes, hardly seen any cases at all. I was literally told by senior doctors in some of those countries, we don't have type 1 diabetes in this country. But clearly there are people with type 1 diabetes, and we've been very actively working in those countries, increasing diagnosis and providing free insulin, free blood testing, and free education support for doctors and families and patients in those countries. We also then expanded our program to some of the other countries in Southeast Asia where there were some gaps. So although there's in for instance, Malaysia, there's very good coverage and access to insulin, not everybody has access free for blood glucose monitoring, which, as you all know, is absolutely essential. So we decided also to start a programs also in Malaysia, Thailand, and Vietnam. So it's a kind of bit of a hybrid there. We don't do so much in those countries, but we still consider it's really important, and we want to really help young people with type 1 diabetes live their life to their absolute full potential. So that's what we do as an organization. In addition to providing medical support, education, and training, we run and organize diabetes family camps. And we have a program, actually, a scholarship program for university and for vocational training for young people with type 1 diabetes. So if you know anybody that you're involved with supporting who has type 1 diabetes, who you believe has got a lot of potential, maybe it's very difficult for them to afford to go to university, we're very interested to hear about them. We'd love to provide some scholarship programs in Malaysia. So on that point, I think I'll stop there because there's a lot to go through today's meeting, but hopefully you understand a little bit more about who we are and why we do what we do across Southeast Asia for people with type 1 diabetes, and delighted, of course, to be able to further upgrade our program and activities with Hello Type 1 launch in Malaysia. Thank you very much indeed.
Thank you, Charles, for this introduction. So here is today's agenda. We have the great honor to have YB Dato, Dr. Asmayani, Deputy Director General Medical of the MOH, for the opening speech of this event. Unfortunately, she will not be able to make it due to conflicting agenda, but she has sent us a recording when she recorded herself for the opening speech. So I will play the recording, the video for you today. Then Dr. Faisul, Consultant Public Health Physician and Deputy Director and CD at Perak State Health Department, will talk about the diabetes landscape in Malaysia. Professor Yazid, Consultant Pediatric Endocrinologist at UMMC, will refocus this event on type 1 diabetes and share some very important facts. Then finally, I will introduce the Hello Type 1 program, and I will do a live demonstration before concluding this event with an open discussion where you can ask all your questions. So unfortunately, YB Dato, Dr. Asmayani is not able to talk, but I will play the video. We'll hear it and let me know if it's not the case. If not, we just abandon.
Yang berbahagia, Profesor Dr. Muhammad Yazid Jalaluddin, Deputy Dean Faculty of Medicine, University of Malaya. Yang berusaha Dr. Muhammad Azman bin Yaakob, Director of Medical Development Division, Ministry of Health Malaysia. Yang berusaha Dr. Faisul Izwan Mustafa, Consultant Public Health Physicians and Deputy Director NCD, Disease Control Division, Ministry of Health Malaysia. Distinguished guests, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh. A very good morning and salam Malaysia Madani. It gives me great pleasure to welcome you all to the launch event of the Hello Type 1 program, a groundbreaking online education program aimed at empowering the Type 1 diabetes community. As the Ministry of Health Malaysia, we are proud to support this initiative from Action for Diabetes that will make a positive impact on the lives of people with type 1 diabetes, their families, and healthcare professionals. Chronic condition due to an autoimmune disease targeting pancreatic beta cells that results in lifelong absolute insulin deficiency. Type 1 diabetes is frequently associated with reduced quality of life, serious long-term complications, shortened life expectancy, and substantial costs for individuals and healthcare systems. Evidence suggests that type 1 diabetes prevalence and incidence are increasing over time. Global and country-specific estimates of type 1 diabetes incidence have recently been published and reported more than 8 million individuals with type 1 diabetes worldwide in 2022, with 1 in 6 of these individuals below age 20 years. The IDF Atlas Type 1 Diabetes Report published in 2022 cited that Malaysia has an estimated 7,000 individuals with type 1 diabetes. Type 1 diabetes is a particularly challenging condition as it requires constant management, monitoring, and self-care, which can be overwhelming for people living with the disease. Diabetes self-management education is an essential and critical tool to achieve treatment objectives such as achieving glycemic control, minimizing hypoglycemia, and optimizing quality of life. Ladies and gentlemen, the Hello Type 1 program is an innovative approach to address this challenge. It offers an accessible and interactive online platform that will provide essential information, support, and resources to the type 1 diabetes community, including people with type 1 diabetes, family caregivers, and healthcare professionals. The program aims to empower the community by fostering knowledge, skills, and confidence in diabetes management, leading to improved health outcomes and a better quality of life. All content has been reviewed and translated to Bahasa Melayu or Malay language and adapted towards Malaysian culture by the University of Malaya, led by Professor Yazid and Professor Azrianti's team in collaboration with the Malaysian Diabetes Educator Society or MDES, and the Malaysian Endocrine and Metabolic Society MEMS members. This ensures that the program is culturally relevant, linguistically appropriate, and tailored to the specific needs and context of the Malaysian diabetes community. The Hello Type 1 program is an initiative from Action for Diabetes, a non-profit organization dedicated to give health and hope to the people living with type 1 diabetes in Southeast Asia. It represents a significant step towards a more comprehensive and integrated approach to diabetes management in Malaysia. We believe that by working together, we can achieve better outcomes for people with diabetes and reduce the burden of this disease in our society. In closing, I would like to express my gratitude to everyone who has contributed to the development of the Hello Type 1 program, including Action for Diabetes, University Malaysia, MDES, and MEMS members. I would also like to commend the commitment and dedication of the diabetes community in Malaysia who are at the forefront of diabetes care and advocacy. I urge everyone to take advantage of this program and to spread the word to others who may benefit from it. Let us work together towards a healthier and more empowered diabetes community in Malaysia. With that, thank you so much. Assalamualaikum warahmatullahi wabarakatuh. Terima kasih.
So let's move forward. So now I would like to welcome Dr. Faithful, Consultant Public Health Physician and Deputy Director of Public Health at Perak State Health Department of the MOH. And I would like to thank him very much for his support and for agreeing in sharing today with us about the diabetes landscape and the increasing burden of NCD in Malaysia. Dr. Faithful, the floor is yours. You can share your screen.
Thank you, Charlotte. Can I confirm you can see my slides? My audio is clear?
Yes.
Great, thank you. So, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Very good morning, good afternoon, and good evening. Thank you for giving me the opportunity to speak at this event. What I will be focusing on briefly is more on type 2 diabetes. We do have type 1 here to me, Charles, so don't worry, there's no denial. But the numbers are quite small. And I will highlight certain things that I think are relevant in type 2, which will need to be considered when we work with type 1 diabetes patients. In terms of the burden, we have our population-based surveys. The latest, the one that we have is in the year 2019. We do it every 4 years. So we will start the collection of data for 2023 soon. And by the end of the year, we hope to have the latest available data for the NCD burden in the country. But in summary, even in 2019, we estimate about 1 in 5 Malaysian adults have diabetes, and the combination, Malaysians having more than 1 NCD is the proportion. The prevalence are also going up. Looking specifically at type 2 diabetes as a case study, in terms of numbers, we estimate we have about 2 million Malaysian adults living with diabetes. These are known, that means diagnosed. And 3/4 of these known diabetes seek treatment at MOH healthcare clinics in particular. So for those working in clinic kesihatan, our MOH health clinics, this constitute quite a large burden of patient load coming to the clinics. Slightly different with type 1. Type 1 are usually followed up in hospitals, not so much in our health clinics. We did a study on the costs of NCDs together with WHO and Deakin University. We did both direct and indirect. And the year of reference for these 2 publications is for the year 2017. As you can see here on the screen, the indirect cost is on the left and direct cost is on the right. And the one in dark brown indicates the cost for diabetes. I don't mean to go into much detail in this short presentation, but the link for the published reports is provided on the slide. And I give consent for the Secretariat to share my set of slides with any of the participants who are interested to look at the slides. what I would like to highlight in terms of indirect costs, productivity losses, diabetes contribute the most compared to in addition to cardiovascular disease and cancer. And in terms of direct healthcare costs, the main bulk still comes from diabetes care. All right. So this is where I think this is where more relevant, whether we talk about type 2 or type 1. When we talk about the whole continuum of NCD care, and you can substitute that with diabetes care, in terms of the title. We have about prevention, early detection, diagnosis management, rehabilitation, and palliative care. Yeah, type 1 is not so much prevention. It's basically early detection. But the other aspect that we often forget is that while we focus more on the supplying, that means making sure services are available. That means the provision of services. What sometimes we forget is about the demand side. Just because the service is available doesn't mean that our patients want to use it. And this is particularly challenging in Malaysia across the board, not just for diabetes, even for hypertension, even for cancer. Just a brief example, just because we have a National Cancer Institute in Putrajaya, all patients want to seek treatment there, because I know there are specific examples where patients wait until stage 3, stage 4 before they come, despite the fact they live barely 5 kilometers away from the Cancer Institute. There are many reasons why for this. But if we don't take this into account, a lot of our initiatives are very much focused on the provision side, the supply side, not really looking at the demand side. And just to highlight these points, firstly, we also look at level of health literacy of Malaysians during our population-based survey. This is across the general population. What I have not included here, surprisingly, is that although 1 in 3 adults have low health literacy, we found that people living with diabetes have lower health literacy compared to the general population, which is kind of a bit weird, right? Because they do see healthcare providers and you would expect them to have slightly higher health literacy, but we're seeing that anomaly. The other thing is looking at the demand side. We did a quick survey looking at where patients would rather get their information, and this is looking at type 2 diabetes patients who seek treatment in MOH healthcare facilities. And we found that majority still prefer face-to-face. They would like to get information from the healthcare providers. Maybe a lot of the healthcare providers on this seminar right now would say, well, doctor, patients don't want to listen to me. But actually, patients would rather listen to you, despite what you may feel. Traditional media still rates very high. And this is not surprising. The mean age for type 2 diabetes patients seeking treatment in MOH healthcare facilities is 60 years old. So they do still watch TV 1, TV 2, TV 3, whereas the people in this group probably on Netflix only and don't watch the terrestrial TV at all. Next is new media, WhatsApp. WhatsApp groups. Malaysians love their WhatsApp groups. You're in Thailand, right, Charles? So Thailand is slightly different. They have Line. They don't use WhatsApp. And apps rate very low. So I'm not saying don't use apps, but we need to understand why they don't use app and address that first. Just because an app can bring you to the moon and back, that our patients want to go to the moon and back. So this is the things that I would like to highlight. And just to transition to my last slide to end my short presentation. The 3 key points I like to highlight. Firstly, the burden of diabetes is high in Malaysia and will continue to increase. And I suspect it will be the same for type 1 as well, although we don't have population-based surveys for type 1. Within the continuum of care, yes, focus on the supply side, but do not lose sight of the demand side. This is something we need to address proactively. Understanding behaviors, especially when we talk about digital health, the interface between the technology and the human, very important. And lastly, specifically for us working in Malaysia, Malaysians are a funny lot. The weird things that we do, too many things. Even for us medics, right? Talk about healthy living, then put us in a 5-star restaurant. So whatever behavior that we preach just goes outside them, Anyway, so I think it's very important to gain insight on behaviors. When we had our previous health minister, KJ, one of the things that he emphasized also on behavior science, which I actually concur. So just to recap, burden is high. Look at the supply-demand side, and we need more people to work on the behavioral science space, especially for this project that we're working on, type 1. With that, thank you very much. I'll pass it back to you, and Charlotte.
Thank you so much, Dr. Faisal, for this very interesting talk. And now let's focus on type 1 diabetes. So I would like to welcome Professor Yazid, who has been such a great supporter of Action for Diabetes since the beginning of our operations in Malaysia. We are very grateful for your help, Professor Yazid. And I would like also to take this occasion to thank Professor Adherence, working closely with you, and her team, who took an active role helping us translating and adapting the low type 1 content into Bahasa. So, floor is yours, Professor Yazid.
Thank you very much. And can you hear me and see the slides?
Yes.
All right. So I'll just give a little bit on what type 1 diabetes is in Malaysia and why we strongly believe that education is the main thing. I mean, that's what we have been preaching, and that's what we have been doing for probably more than 20 years since we started treating type 1 diabetes in Malaysia, especially in UMMC, where I'm working currently. So, I mean, if we just look at the prevalence and incidence of type 1 diabetes in 2019, we understand that there were 600,000 children and adolescents with type 1 diabetes, and 98,000 children and adolescents were newly diagnosed by the year 2019. And about 1.98 billion children worldwide were there in 2019, but as you see, 600,000 of them has type 1 diabetes, and the annual increase is about 3%. The thing is that what we need to understand about type 1 diabetes is that it occurs more commonly if there is a family member with type 1 diabetes. So 15 times more commonly compared to general population prevalence of only about 0.3%, but the family prevalence of approximately 6%. Previously, we understand that type 1 diabetes is mainly related to the European countries, the Scandinavian countries, but I think more and more information that we gather in the last 10, 15 years, that as you see on your left side, the country with the highest number is still from the Scandinavia, Finland and Sweden. But if you look at the one in yellow, those countries from Middle East and North Africa is coming up very rapidly. Kuwait, Qatar, Algeria, and Saudi Arabia are one of those countries that have a high incidence of type 1 diabetes in children. And we do understand that there are a number of peaks in terms of the years where the incidence increases, especially those young ones around 2, 4 to 6 years old, as well as during adolescent at 10 to 14 years. And this is basically related to the pattern of infections, because I think there are some studies to show some association with the enterovirus and the trigger to develop type 1 diabetes and so on. And for the adolescent, it's mainly related to the increase in the insulin resistance during puberty. So what about in Malaysia? This is something that we have done before. We have our Diabetes in Children and Adolescent Registry, which we call as DICARE. Dr. Fuzia, I think, is one of our participants today. So thank you, Dr. Fuzia, for really spearheading this work. It was actually launched in August 2006, and by June 2007, we have registered 166 type 1 diabetes children and adolescents below 20 years. And Dr. Janet, in her study published in 2009, looking at diabetic ketoacidosis in type 1 diabetes, also coming from the registry up to December 2009, we actually have registered 490 type 1 diabetes until 2009. Unfortunately, our registry died off. Okay, we had to stop because of funding issue. And since 2009, we do not have a national registry of type 1 diabetes. However, In October 2022, last year, we did have a nationwide survey among our pediatric endocrinologists looking at the number of type 1 diabetes below 18 years. We actually accumulated about 1,357. So you can see that from 2009 to 2023, over a 14-year period, the number has actually tripled from just about 490 to now about 1,400. We think it's more than this. So yeah, I mean, there are more things that we can do if we do have a registry, but just not having a registry doesn't mean that you can't do much. So from our own UMMC group of doctors and fellows, we actually look at the misdiagnosis of type 1 diabetes that appear at our hospital in UMMC. So we notice that among the patients that we see in UMMC, 38.7% were misdiagnosed, and respiratory illness were the most common. And the rate of misdiagnosis remained the same over a 10-year period. I mean, it's very disheartening to see, despite all the work that you do, despite a good amount of education that you try to address among parents and children, or even to the community, we still see that among our healthcare providers, we still have, a plateaued kind of misdiagnosis, plateaued prevalence of misdiagnosis of about 30 to 40%. We found from this study that younger age, that means those children below 5 years at presentation, the DKA at presentation, and the healthcare professional contact and the admission to ICU was significantly different between those who were misdiagnosed and correctly diagnosed. So the number of doctors that you see before you came to the hospital tell us that there is a risk factor that this patient will be misdiagnosed. Basically, among our healthcare providers also, we need to improve in educating them in order for them to better diagnose type 1 diabetes in children. We also did some study in looking at the self-care management of our children and adolescents with diabetes in Malaysia. Prof. Shafina just published this data in Journal of Child Healthcare in 2023, just about 2 months ago. When we look at type 1 diabetes among children seen in UMMC and in UITM, we noticed that the metabolic control is poor. 10.1%. Again, I believe this poor metabolic control is really largely related to the amount of knowledge that the patient and parents know in managing type 1 diabetes. And from this paper, we conclude that the self-care activities among children and adolescents with diabetes are suboptimal, and diet subcategory actually correlated negatively with glycemic control, be it type 1, be it type 2 diabetes. So there's a lot of work that we need to do in looking at the diet in both type 1 and type 2 children with diabetes. So it's very important for us to understand about type 1 diabetes. This is something that we do before. Everything revolves around insulin, the food and the lifestyle. And this should not be it anymore. This is old school kind of education. But what we need now is to make sure that the insulin that we give to these children revolve around their lifestyle and their food, rather than insulin is the major factor. You take your food and your lifestyle based on your insulin. So it's the other way around. And this gives a lot more flexibility as well as reliability. And I think with this kind of life that the patient can go through, they will live to the fullest. They will live. They will not be not happy even though they have diabetes. So it's very important for us healthcare provider to teach them correctly. And because of that, in UMMC, we have our own teaching module for any patient that get admitted to the ward. As you can see here, from day 1 until they got discharged within the first week of diagnosis, they have to go through a lot of education. They have to pass all this module, and we usually have some kind of assessment before they were discharged. And these are some of the materials that we actually have, and we actually put it into their file to bring back home. I believe in education, not just in the hospital, but something that they can bring home with. Because I think sometimes when we just talk to them and tell them about the story of type 1 diabetes, sometimes they don't have anything to refer back to, and that causes the level of education or level of knowledge to drop over time. When we actually presented to them a file of type 1 diabetes with all this information, we noticed that the engagement is better. And whenever they come back to clinic, we'll ask them on some of these topics. We also have posters that we put in our clinic to make sure that they continue to have a healthy lifestyle, exercise, their food, and we also look at their, the healthy living condition, some psychological impact and all that. And for school-wise, we do have some education materials as well for parents and patients, both in English and in Malay. And we do have other education materials, as you can see from here. And for Ramadan, because I was also involved in the guidelines, because we know type 1 diabetes patients in Malaysia would like to fast during Ramadan, just like their friends. So because of that, every year we have this workshop that we do online for children and parents with type 1 diabetes who wants to fast during Ramadan, so that they can fast. In a safe condition. And this has been going on over the last 3 years at least, after we have had our ISPAD guidelines up in year 2018. And we do have camps every year. As you can see, the children are very happy when we have them in camps. We get our dietitians, psychologists, sports medicine specialists to come along with us to show them how they can live healthily, even as a person with type 1 diabetes. So we do have workshops for healthcare providers. As I said, this needs to be done on every year, so that the level of knowledge continue to improve and try to avoid all these issues with misdiagnosis. Prof. Yanti again had actually spearhead this Lina Ada Diabetes, a simple book for the patient and parents to understand in a simple words, more into the arts, what type 1 diabetes is, what can they do when they have type 1 diabetes. And more recently, with Professor May Ng and Charles, actually we came up with this study. I think this is very important. Working with NGOs, working with everybody to make sure that type 1 diabetes is there, is in the map in Malaysia. This is important so that people know that type 1 diabetes is an issue. It's an issue in Malaysia, even though it maybe the number is not as many as those in a European country, but it is important, and it is very, we need to make it more prominent. And this is the reason why we also need to work with our patient group to actually really move this, the need for all the materials, the management of their sugar and all that to the higher level, so that they can be covered even under the government, not just through the NGO with the insulin, but everything else about diabetes needs to be heard of. Okay. And as I give you kind of like a round summary, this global incidence of type 1 in children is increasing, and it has the potential to become a major public health issue in Malaysia. As I showed over the last 10 years, it has tripled the number. And we know that metabolic control is poor, and diabetes self-care is suboptimum. And hopefully with this diabetes education, we can improve metabolic control. And I believe education is the key. So thank you very much. That's from me. Thank you, Anne, and thank you, Action for Diabetes, for including Malaysia in your journey to help our type 1 diabetes. And I hope patients, parents, friends here who are listening, this is what we need to do. Thank you.
Thank you so much, Professor Yazid. That's exactly that. I think you summarized. Now it's time for me to finally share about the Hello Type 1 program. And first, I would like to ask you just a couple questions. You will see the question appearing on your screen. So first, as a healthcare professional, do you often deal with type 1 diabetes patients? So yes, almost every day, not very often, or not at all. Just to have a bit of an idea of the audience. I will keep the poll open for 10 seconds and then I will close it. Everyone is still okay. I will end the poll now and I will share the results. So you can see that it's great because almost 60% of all of you here are dealing, 60% of you here are still dealing with type 1 diabetes, but not that often. And 30% are more dedicated to type 1 diabetes. Back. And I will ask you another question. Are you already using any digital tools to educate your diabetes patient? Yes for type 2 and 1, or yes for type 2 only? Or not at all? Okay, interesting. I will end the poll now and I will share the result. Okay, so you see it's 50-50. So 50% of you don't use any digital tools. So I get you're using like traditional materials like leaflets and posters and booklets and things like this. So this is basically what we offer. So Hello Type 1 has been created as a digital tool to educate your patients living with type 1 diabetes and their families. Of course, there is a lot of content through the platform that can be used as well for type 2 because nutrition, complications, this is universal around diabetes topic. So let's start. What is Hello Type 1 mission? So it's to give access to unlimited and accurate information about type 1 diabetes in Bahasa. Hello Type 1 has been designed to inform and support everyone who has their lives affected by type 1 diabetes. If they are living with diabetes or caring for someone with diabetes, because it's very important to not forget the family. The program aims to educate, engage, and empower. Hello Type 1 provides fundamental information in clear and engaging formats, helping both patients and caregivers to improve their understanding of the condition. Hello Type 1 brings the T1D community together on social media, fostering a positive and interactive environment for people with type 1 diabetes to use their own experiences to help each other and to overcome the challenges. Hello Type 1 helps people with type 1 diabetes and caregiver to gain knowledge, confidence, and strength to take control of their health condition. So Hello Type 1 is an ecosystem made of one website. So it's hellotype1.com/my, which is the resource center for type 1 diabetes information. And we also have a Facebook page, which is at Hello Type 1 Malaysia for community engagement and psychosocial support. The website has been created for three types of audiences. The young people living with type 1, the families or anyone caring for someone with type 1, but also healthcare professionals like you, where we are developing webinars related to T1D topic, like carb counting, for example. And we also meet once every quarter during our T1D network meeting to facilitate best practice sharing and cross-country collaboration with the other HCPs of the region. Like Professor Yazid mentioned, the study we have worked together, the publication. This is a really good example of cross-country collaboration. We need to work with other healthcare professionals of the region. So if you haven't already joined one of our T1D meetings, you can do it next. I'm sure you will learn a lot. The Facebook page is focusing on supporting people with type 1 and their families by engaging and empowering them. So we are using Facebook today, but we will integrate as well Instagram and TikTok soon. On this Facebook page, we are sharing content from Hello Type 1 website, but we will also organize patient workshop with Facebook Live. We'll share patient stories, inspirational quotes, and practical tips. So how can it help patients and families? Hello Type 1 content covers 8 core topics for now. The content is curated for the topics using information only taken from accredited sources, such as IDF, the International Diabetes Foundation, and ISPAD, the International Society for Pediatric and Adolescent Diabetes. This content is then reviewed and adapted by a panel consisting of healthcare professionals like endocrinologists, nutritionists, diabetes nurse, psychologists, and members of the Southeast Asian T1D communities, helping to ensure that the information is appropriate in the local context, because Malaysia is not Thailand and it's not Vietnam. Every country has their own specificity, so we need to make sure that the content is adapted to Malaysia, for example, in that case. For each topic, people will find some articles, but also posters, quiz, and videos. I will give you a demonstration in a few minutes. The content has been designed for you, for healthcare professionals as well, to be used as tools to educate your patient. You can use the video during workshops or if you have a screen in your waiting areas. All the posters made can be downloaded, printed, distributed, even if they have been adapted more to the mobile format, which is easier for people to see content. The content available is in constant evolution. It's not so we created with 8 core topics, but we want to make the website evolving all the time. So more categories are coming to cover all aspects of life. We are currently working on it. So we will talk about diabetes stigma, life at school, job employment, how to share to your employer that you are living with the condition, and more support as well for parents. I am worried my child has type 1 diabetes, or how do I deal with this new diagnosis? So we will produce new content on a monthly basis. As explained previously, we are also focusing on engagement and empowerment of the T1D community. So we are here to help them to overcome their struggles, stigma, and encourage them to have the best life they can have. Having the support of the healthcare professional and having the best insulin regimen in place is the most important. But there is also the stigma and struggles they are living at home, and it's where Hello Type 1 can also make a difference in understanding and supporting them. We are trying to build a community as well across the region of type 1 diabetes advocates, where people can share about their lives and help each other. We are also collaborating with artists living with type 1 diabetes that can inspire others. So now, let's do a live demonstration. So I will just show you the website, how it works. Like this, you can have, I think, a better idea. So I'm going back to sharing my screen. With all those sharing process, my window was not open anymore, and it's there. Perfect. So this is the website. I'm showing you, of course, on my laptop, but all the content is optimized for mobile, because the reality is that 95% of the people in Asia are checking content on phones, not on laptop, of course. So I show you on laptop, but everything is adapted on mobile. So this is the homepage. So we just welcome people, and directly we focus on who you are. Are you someone living with type 1? Are you someone caring for someone with type 1? Or are you a healthcare professional? I will show you briefly the healthcare professional category right after, but currently, like, let's focus on patients and family. So, okay, let's say, yes, I have type 1 diabetes. I enter the content. You can also enter by the main menu, of course. And then you will see the 8 core topics. So those topics are information about the condition itself. What is it? What is type 1 diabetes? Blood glucose monitoring, insulin treatment, hypoglycemia and hyperglycemia management, sick days, nutrition, exercise, complication, and emotional support. For example, let's take an example. Let's go to the blood glucose monitoring category. So you have articles available. And for example, if you click on one article, so you will have the article that we have developed. So you will have the details that people can read, of course. But to make it more fun and easy to learn, we have also all the time for this category, for this topic, we have always videos and we have posters, and people can test their knowledge with a quiz. So or they can access to those posters and video on the articles, but there is also, of course, from the menu and even from the homepage below, you can directly access, for example, to all the video library. So I will show you an example. So for example, like this first video, people can just open it and directly watch it on the website.
Apakah diabetes jenis 1? Diabetes jenis 1 adalah glukosa sejenis gula merupakan sumber tenaga utama. Inilah yang berlaku pada orang biasa.
So all those videos has been developed to really explain the basics. So this video, for example, that I just showed you, explain exactly how your body works when you don't have diabetes, type 1 diabetes, and how your body works when you have. Really, we think that it's very important that people understand what is happening with their body as well. We have videos about all the time the basic, like why I need to monitor my blood glucose every day, but also another video on how to do it with a demonstration. What is insulin and the different regimen, and how to inject with a syringe and vial, how to inject with a pen, how to manage my hypoglycemia, how to manage my hyperglycemia, and we have as well a video on nutrition. More videos are coming as well about complication that we will adapt soon. One video is as well one day at school, because we think the school environment is very, very important. And if I remember well, one video about exercise. Now we'll show you how the posters look like. So same topics, and instead of having an article or video format, we have those posters. So if you open the poster, I will just zoom out because we made it really easy to check on the screen of your phone, because by doing some feedback surveys, we know that people are checking that on phone. So that's why if you print it, it could look big, but on the phone format, it will be perfect. And same, we centralize here the main information to teach people how, for example, in this one, how your body works when your body produces normally insulin, and how it works when it doesn't, and how the blood glucose is built up in your blood, what are the symptoms, this kind of thing. So we chose really this kind of fun and nice format with really strong color to make people like, way more user-friendly, basically. So you have those posters for every topic. if I go here, you will see blood glucose, insulin, hypo management, hypoglycemia management, days, blah, blah, blah. So all the time you have those formats for all. So that's what we have built currently for patients and family. I can show you as well briefly the healthcare professional category. So if you are interested, there is a category for you. You just need to register to have access to the content. But basically, we have webinars that we are producing. We have linked as well all the important type 1 diabetes educational resources, like all the booklets from ISPAD. And there is as well this amazing e-learning platform from the European Society for Pediatric Endocrinology. So you have all the link here. And there is this network meeting that I mentioned that you can join. And we as well list all the publications that has been published that we all work together, like the one Professor Yazid mentioned. So for example, I'll just show you one example. If you go to the webinar library, you will see all the library of webinars that has been done. For example, the last one was from Dr. Tanini in Thailand on transition of care from emerging adult, from pediatric to adult, how in Chulalongkorn they transition the people from pediatric to adult department. We had as well this very good video on carb counting by Dr. Seriman, who is Thai but based in the US. And we have as well retinopathy, many of them. So you can just check the library and you can watch a pre-recorded video on your own time. So that's for the healthcare professional category. And what we have as well, and what you can all do is following the Hello Type 1 Malaysia Facebook page. So we just launched it because we wanted to wait for this launch to start building content there. So here on this page, as I mentioned before, we will just share content like the videos available on the website. It will be shared on the Facebook page. There will be publication 2 to 3 times per week. The posters will be shared as well, the articles, but also more and more we're going to work in Malaysia. We will like to show, as I explained, like patient stories. We will organize online workshop. And one thing as well, actually, I will mention at the end of this meeting. But if you have an event, if you have a diabetes camp, we can also promote it on the platform. If you have workshops, if you have a new material that your clinic or hospital produce, we can host it on the platform, but we can share it as well on the Hello Type 1 Facebook page. So it's really what we try to build is the community on the Facebook page for people to basically to be all there and to be able to know what is going on the type 1 diabetes field in Malaysia. So that's for the live demonstration. So now I will show you how to share this information with your patients. And after we will move to all the questions you might have. So moving forward. Now it's very important to emphasize that this program will not exist without your support. You see the Facebook page. If we have no patients or caregivers or even all of you there, it's not gonna work. So we have built this program to facilitate the access to information, but it's with your endorsement and your help to relay the information to your patient that the program can succeed. So please share with your patients and their family. We have designed this flyer that you can see here, that can be flyer/poster, let's say, that can be distributed and sent to your clinic to be available for your patients. We would advise that, you have this little flyer in a plastic stand, for example, in your consultation room, because there is the QR code that patient can directly scan. So when they scan the QR code, they will directly land on the Facebook page on their phone. So they can, normally they just will have to just log in on their Facebook apps and follow the page. Like this, we thought that it's easier because they are within the community on the Facebook page, and then they can have access very easily to the website and to everything that happened on Facebook, but also like all the time information is relayed on this page, so it's very easy for them to go on the website and then navigate. So it works like this. And of course, if you have any suggestion on how to promote the program, we'll be very, very happy to discuss that. So here is the promotional material option available. So, or we can have it in an A3 poster that can be hang out in a waiting area in your clinic. The flyers, or it can be just for distribution, or it can be in this little stand that people can just scan. Or we can also have only the sticker, the QR code as a sticker, that if your patient has a blood glucose diary, for example, we can stick on it. And what I propose to do is that in the next coming weeks, I will send an email to all of you asking you what you would like to have. So like it's going to be like a bit like an order form. How many posters you need, how many flyers, and or the sticker, and we will manage the printing and the distribution to make sure that all those materials are available for you to be able to share. And yeah, I think now we can open the discussion and all the questions, because I guess you may have. So please don't hesitate. You can turn your camera as well, and yeah, I'm welcoming all the questions. I will open the chat as well if you want to type it. Like, and Fiona, Rachel, Joanna, Youngswan, you can help me as well, because I haven't been able to read the message during my presentation. So let me know if there is question.
Hi, AC. There is one question from YC Kwan. I think probably maybe Dr. Faisal or Prof. Yazid can take this, because on the chat, this YC Kwan mentioned, he or she asked, any study on how our nation's food environment is having an effect on NCDs, especially as obesity and type 2 diabetes is on the rise? I believe that this question is addressed to Dr. Faisal. Dr. Faisal, can you see the question on the chat?
Yeah, I can. That's quite a difficult question to answer. So I'm going to answer that in my previous capacity. It's not fair, because I do have a replacement person. And the scope of my work is slightly different now. If you look at food environment, I suppose we can look at eating behavior first. So that one we do know, even part of the National Health Mobility Survey. So just an example, intake of fruits and vegetables is very low. And the latest Adolescent Health Survey, which we did in 2022, which just released, I think last week, showed that even among adolescent, fruits and vegetables intake has gone down even more. So I would say we have proxies. Prof. Yazid, for example, worked in the childhood space and childhood stunting, childhood obesity. So it is not just, I would say, food environment, but also the behavior component. It is, maybe Yazid can answer me better lah. This is quite a complex, it is a straightforward question, but it's not just environment, or is it knowledge, or is it just poor choice? I don't know, is it?
Yeah, thanks, Faisal. I think the NHMS 2022 last week actually gave us a very clear picture. Adults or adolescents, the choice of food, the breakfast, percentage of adolescents taking breakfast every day among overweight, obese, what's their breakfast uptake every day. Not to forget the salt, the sugar, other than the veggie and the fruits. I mean, we have done a qualitative study in school among adolescents, and it's a longitudinal study, 13 to 17 years old. It's all published in under the My Heart study. We try to understand the behavior of children in terms of the choice of food in school, as well as the behavior of the canteen operator, looking at the, what kind of food that they actually sell. There's a lot of things going on. It's not just about the price. It's also about the policy. So when it comes to food behavior, it's not just one thing. It's everything. So that's why when we talk about trying to cut down on the prevalence of obesity, we cannot just go to the community, but we have to go to the higher level, looking at the policy as well to make sure things are done concurrently. So it's a tough thing to do, but I think that is something that we really need to do with the current prevalence of overweight obesity that keep on increasing, not just in adults, but also in children and adolescents. Yeah.
So just to add to what Prof. Yazid mentioned, when we think about food environment, we think about things that we can regulate, restaurants, schools, but the food served in your own home, it is an environment which we can't regulate no matter how we like to regulate. So that's why I state that I don't have an easy answer. Then how do you regulate parents to provide a good food environment at home? And because even when you have money, not necessarily mean you are able to provide the correct food environment. If not, then childhood stunting will not be high in Putrajaya, for example, right? Is it? I don't think we hardcore poor in Putrajaya.
No.
So it is not just money. It is poor choice, or is it? We all have our own anecdotal theories. It is all interlinked. So yeah, any one of you got any ideas how we can approach this? I'll be more than open to any suggestions. Back to you, Fiona.
No, thanks very much for your comment. So I think, like you said, there are a lot more work that we need to do. So I think one of the problem that one of the issues that we need to address is the outreach of whatever good work that you or we are doing or we might be doing together. So I think in the era of this technology, like new technology, where we have a lot of development in the technology, so I think we definitely need to leverage the digital platform so that the outreach of our work will be wider. So, for example, like the workshop, like the online workshop that Prof. Yazid you did with, about the Ramadan thingy, that thing, in the future, if let's say you want to do something like that, we are very happy to play our role to collaborate with you so that, for example, we can put it, we can promote it on the Hello Type 1 Facebook page so that we can reach out to more people, whether or not they are living with Type 1, whether or not they're living with diabetes or the carrier or any healthcare professionals or any public who want to learn more. They can always join so that, we can sort of like double or triple or whatever the impact of our effort. So I think let's try to utilize this digital platform that hopefully we will see some improvement in the very near future. Yeah.
No, and it's true that actually, like we have an article on nutrition and explaining the basic of nutrition, what is the carbohydrates, proteins, and everything. And actually, we have work with Yongzuan, who is I will actually. I can just do it right now. So my team, I am working with Joanna Ko, who is she's living with type 1 diabetes herself. She's living with type 1 diabetes herself, and she's a digital learning and development manager. She's focusing really on the social media and patient engagement and empowerment. And I have as well, we're working with Yongzuan Oi, and we are so lucky to have her as a coordinator for Malaysia. She's a nutritionist, she's a diabetes educator and MDES member. And Yongzuan and myself, we have worked in the past week to edit this glycemic index table for Malaysian food. And I think this is very important because when we work together, we realized that there was many different information. And sometimes like the tables I got and the information was not all the time the same about the GI index of the different food. So we spend a lot of time analyzing and working together to have something clear and simple for people to understand. But it's true that this is a very, very, very important topic. And I can see as well the difference between countries. And I think same, it comes as well from education. And as you say, Dr. Faisal, it's not a question of money. Often it's a question of habits. And it's very difficult to convince, and it's everywhere in the world, how convincing people to take some better health habits, and that's to increase the level, for example, of fruit and vegetables in your diet. But yeah, this is really a topic I'm personally passionate about, and we would like to organize workshops on this specific topic because I think it's very, very important.
Yongzhen?
Yeah, Yongzhen, do you want to introduce yourself?
Oh yeah, hi, I'm Yongzhen here. I'm actually a diabetes educator now, working in a private hospital. So yeah, I think the launching for Hello Type 1 Malaysia is really amazing because it actually consists a lot of our Malaysia elements which are suitable for our Malaysian Type 1 diabetes patients. And as a diabetes educator, I am really fully agree with Dr. Muhammad Yazid just now that he mentioned a lot on the importance and the essential needs of diabetes education, which we always play the role on educating patients on understand what disease they're actually having, and we try to let them be independent. So I think it's very good that we have this Hello Type 1 Malaysia in Malaysia now. So I hope that more information and more program we can actually come up to help our Type 1 patients.
Thank you. Thank you so much, Yongzhen. Does anyone has a question about the program or for Professor Yazid or for Dr. Faisal? All
Can
right.
I say something? And
of course.
I've noticed this for some time. I think we, the healthcare providers, are doing a lot of things, a lot of work. Sometimes we felt really bad for our patients because a good number of them has to fend for themselves when it comes to financial support in try to make sure that they get the best when they try to manage their diabetes. So I know within this group, there are a number of parents and patients. I can see some names there. Some of them are my own patients and parents. So I really would like to urge, I think when it comes to getting the funds, getting the support from the government, the voices of the patients and the support group and the parents are louder as compared to the voices of the healthcare professional. So I think we need to come in as a solid group, championed by parents or patients, to help steer this and to help proceed, move this to the higher level and get whatever the support that the type 1 diabetes patients should be getting from the government. So I believe this is what we need to do next. The parents and the patients to spearhead the group to go and get whatever that they need to get, whatever that they want from the higher level, from the government. We here can support that. The HCP can support that, but the first step needs to come from the patients and the parents.
Yeah, that's so true. Do you have any patient support group run by patients or by families at UMMC, for example?
No, we tried. We don't have. think UKM has at one point, but I'm not sure what happened. But I think if we can do it under this Hello Type 1, that will be like everyone can come in and chip in. So you have already categorized under patients and all that, right? Under our E4D Diabetes Malaysia, the Hello Type 1, which I think that can be the first platform.
And I have a question for you as well, Professor Yazid. We have interviewed patients in Malaysia, young adults, young professionals, and it's the same in all the region. The stigma about type 1 diabetes is so important. And I feel really bad because I would like to have to invite all the T1D to be part of it, to be part of the program, to share their experience, and to not be scared of injecting insulin in public, injecting in school. I know that no one wants to show that they have diabetes, and sometimes like they feel that they cannot get married because they are not good candidate for marriage because, you know, like they're living with this condition. So, and I know that all those support groups can exist and can be led, as you say, by patients and families, but if they are willing to be you know, like to be visible and to share their voice. So how do we fight that? How do we convince them that it's okay? It's okay to share your story. It's okay to show that you can have a normal life and you can inject in public at the insulin at the mall, and that you can be with your friends and not be ashamed. I think for me, this is very, very really key things if we want to progress. Yeah. I don't know if you have any.
I think what you mentioned is very important, because I think in our community, type 1 diabetes is still very rarely spoken about. And people don't know type 1 diabetes. People know about type 2 diabetes. And when we talk about type 2 diabetes, people always associate that with obesity, your poor choices, you choose the wrong food, you expose yourself to the wrong thing. So it becomes a very negative stigma when you have when you actually develop type 2 diabetes. And then people don't know about type 1. So because of that, a good number of our patients, the first time they tell their friends that they have type 1, or even their teachers, the first question that comes from the teacher is that, did you eat a lot of sweets that cause you to have type 1 diabetes? So the understanding of type 1 diabetes is not there in our community. And that's something that we need to do. We need to be in TV, in all these social media platforms, doing TikToks now for whatever reason. Yeah. We need to make sure that our community understand what type 1 diabetes is. And I totally, again, agree with you, because recently a parent come to me and talk to me. I kind of be a marriage counselor, because, you know, people do not want to get involved, get married because of the stigma. But I said it's not type 2. When you say diabetes, the person's mind is that it's type 2, because that's the most common, right? When it's type 2, you have a very overweight or obese person, doesn't look very nice, that kind of thing, with all the complications and, you know, all those things. But type 1, they are totally well and good and they are healthy. It's just that their pancreas does not work, and it's not by choice that they do not want. It's not by choice that they have type 1 diabetes. So these are important information that we need to disseminate to the community. We have to go on board. We can, so that is important.
Note that. Thanks very much for the comment.
Yeah, that will reduce the stigma of the community. Yeah.
Prof, I can relate that to my experience, you know.
Thank you for speaking. Please.
Okay, my daughter is actually having a type 1D, and Prof Yazid is actually our prof that actually taking care of our daughter. So this is actually what happened, you know. I think last month we went to a school and we were called by teachers. So we had a meeting with the teachers, the head mistress and the senior teachers, about 4 or 5 of them. So when we first explained that, you know, our daughter is actually suffered from this type 1D, the first questions that comes from them actually was, So what should we do? Is she okay? How's the food? Can she get involved in the sports? So this is something that, again, go back to the public awareness, So we had to explain everything. So we told the teachers that, hey, our daughter is actually normal. She is actually perfectly normal, like other kids, And these are the things that, we are looking at. That's why in my just now short message, I say, you guys, as a professionals, you have done your part and keep on continuing. Try to do the best for the community. But I would rather say that, the government has to play more role in this, not just support in terms of the morale but also for their gadgets. For instance, we in this region, as compared to the like what the profs and also Dr. Faisal explained just now, in other part of the world, in the Scandinavian, they have got the best so-called support from the government in terms of the medicines, healthcares and whatnot. So I think the government has to start to look into this now. I think that's all from me.
And I completely agree. And I just want to mention that following our experience in Action Valley, so we are working in all Southeast Asia. And that's the first time in Malaysia, that's the first time that this program has been endorsed by the Ministry of Health. And that's for me, it was the first step, because when you see at the partners, we have everyone. We have the Diabetes Society, the Diabetes Educator Society that support us. We have the Endocrine Society, the international and the local one. We have the family medicine specialists, the GPs that are here with us. And that's the first time, following our experience, that we have this. And having the involvement and the endorsement of the Ministry of Health, for us, it's a very good first step that will allow, and it's the first step that all the stakeholders are involved. And actually what we miss is probably the patient association. And then maybe we can start to work together further. And I think that's a very good occasion to maybe start to do some advocacy role. I don't know what you think, Fiona, about it, but for me, that's a very strong signal that that's the first time in Southeast Asia that we have been able to gather all the stakeholders to say, hey, this situation is highly important, and education in this condition is key. And as you just mentioned, the stigma, like at school, we see the same story everywhere. I mean, you can ask Joanna, who is working with us. She lived the same thing in the Philippines. And hopefully, things will move forward.
Yeah, so yes, definitely. I mean, this is just the first. This is just the start or the beginning of us launching this education program in Malaysia, and we will continue to reach out to all relevant stakeholders. Not just in Malaysia, the same in other countries, because we try to bring everyone involved in type 1 diabetes care, not just the medical society or community, but also the patient or the family caregivers group. So how we can act together to increase the awareness of this type 1 diabetes and the education. I mean, because you need education to build the confidence of people living with type 1 diabetes to deal and cope with this condition before we can even talk about driving advocacy for better for access to better care. So, or of course, maybe we can also, depends on the situation, all this can be done in parallel. But what we need is the support and joint hand efforts from everyone. So what we can commit here is that we will continue to engage everyone who share the same value and mission. Hopefully we can achieve something significant improvement in Malaysia, and maybe we will give some inspiration to our neighboring countries. This is how we can do it. Yeah. So I'm mindful of the time. So thanks. Maybe AC, you want to conclude this webinar and then ask them to contact us if they want the promotional materials. Yeah.
Fiona, and Fiona, and can I mean, before you close,
Of
can
course.
I just
no
share
problem.
one?
No, yeah, okay.
When going to the community, what we have done with our stunting and short stature and all that, I've done Facebook talk to the kindergarten parents. So something that we can do to the community. So it's not like just go in the newspaper. We have to be very practical and very systematic in the way that we want to do it. So kindergarten parents, you can call all the private kindergarten, even under the Ministry of Health, parents to come and join in, do something like this, and they can listen and they have video that you can just submit. And I noticed that when we do that, we have like 30,000 views, meaning that the 30,000 people listen to you. And if we can do this under one banner like this, that will be very nice. And then we can start going to the primary schools to involve the teachers, parents, secondary school, as what Shauki mentioned just now. See, I can tell you, 10 years ago, we have the same problem. Now we still have that same problem coming from the teachers. So teachers themselves don't understand. So that's how can the public know better when the teachers are supposed to know a bit more, also having issues with type 1 diabetes. So systematic way of reaching out to the community is important.
So AC, I think we have to take note that, I mean, since Prof. Yazid, he has the experience to drive, education in school for other disease area. So definitely we need to, work with him and then see how we can also promote this type 1 diabetes awareness, maybe in collaboration with the Ministry of Education.
Education is exactly what I was starting to say. What I wanted to add is that more people will join the community on Facebook first. If the number is really big, like if we are like thousands of people on this on this Facebook page and everything, it's like bigger the number will be and the number of users, and easier it's for us like to build on advocacy, because we are a larger group. And so that's why, like, the more you can share about the program and the program can be used, and more we can have more resource people in the team to work more and to build more and more and more content. And so please don't hesitate to reach out to us. I have all your email address thanks to the registration of Zoom. So I will send a recording of this meeting like this. You can share with the people, the parents, the patients that hasn't been able to be there, colleagues, junior doctor, everyone. And I will as well ask you which type of material do you want, and we will manage all printing, distribution, and everything. And hopefully, we can start building workshops. Any type of event you think it's relevant. Currently, we are mostly online, but we would love to do some more physical events in the future as well. So thanks again to everyone, to all our partners, to you, Dr. Faisal, Professor Yazid, and please, Professor Adherence, without you and your team, this program will never be there. It's her team who translated all the content and adapt all the content from Hello Type 1.
Yes, I concur this very much.
Yeah, some MDES member as well jumped in. The Baxter team did the voice for the videos. So it was really collaborative, and I really enjoy working with all of you. So once again, thank you for your amazing and committed support to us. It's a very good day. I'm very happy that this program is finally out in Bahasa. Very, very proud.
Yeah, so please do look for Hello Type 1 Malaysia on the Facebook page. Like and share, like and follow, so that it's easier for you to share it with whoever. Not necessarily people with type 1, but anyone to raise the public awareness about type 1 diabetes. Yeah. So with that, thanks everyone again. Is it okay that we take a group picture?
Yeah, maybe we can try. If everyone can turn their camera.
Yeah, if you're happy to turn on your camera, I'll just take one group picture. Are you ready? Oh, hi, Dr. Fuzia. Yeah,
All
okay.
right.
All right. 1,
One,
2, 3.
three.
Again, 1, 2, 3. Thank you very much. So I wish all of you have a good weekend. Yeah.
Yeah.
See you again.
And hopefully see you all soon.
Yeah.
Bye-bye.
Bye-bye. Thanks, Dr. Faisal. Thanks, Prof. Yazid.
Thank you, everyone. Have a good one. I've already followed and I've already shared on my
Thank you.
Facebook. So
Yeah.
I just shared with all my
Bye-bye.
patients. So
Yeah.
hopefully they join. Yeah.
Yeah.
Thank you, everyone.
Bye.
Thank
Bye-bye.
you.